how to make it bigger. Alright, so I guess you're gonna look at that, because I don't know how to make that bigger. Okay, well, good morning class. Today, I want to talk to you guys about psychedelic therapy. What is that, you may ask? Well, it's the use of mind-altering substance to aid in the conditions that cause psychedelic issues stemming from mental health issues, stemming from PTSD, trauma, addiction therapies. So this is kind of what I wanted to talk about. From the National Center of Biotechnology Information, the U.S. National Laboratory of Medicine, National Institute of Health, it states that the use of psilocybin, aka magic mushrooms, the picture we have here, ketamine, MDMA, ayahuasca, mescaline, just to name a few, are used in a certain psychedelic assisted therapy and interventions using these treatments for alcohol dependence, substance dependence, nicotine dependence, anxiety related to terminal illness, chronic PTSD, and research is underway to examine its efficacy in relation to obsessive compulsive disorder, treatment-resistant depression, and social anxiety related to autism, palliative care, among other potential applications. Some of these hallucinogenic substances have been used in holistic medicine and for spiritual practices in various cultures, including our indigenous cultures for thousands of years. But currently in the United States, it is classified as Schedule I drug. According to the DEA, or United States Drug Enforcement Agency, it is a crime. So, but it's kind of used to help others other than using certain medications that are from pharmaceutical companies. How it's used is by microdosing, is how the therapy can be safely administered. These medicines hold such promises for people struggling with PTSD, depression, and other mental health challenges. Matthew X. Lowe, PhD Research Director at Psychedelic Research of nonprofit Unlimited Sciences. But recently, a Colorado Secretary of State's office announced in July of 2022 that natural medicine in Colorado has collected enough signatures to qualify the NMHA proposal for the November ballot. The proposal, previously identified as Initiative 58, will appear on general election ballots as Proposition 22. This will legalize growing, testing, and the use of psychedelic therapy in Colorado. The Food and Drug Administration has deemed that psilocybin is a potential breakthrough therapy for treating depression. A designation that could fast-track a path to new pharmaceuticals. So, I guess you want to visualize this with me, is with today's problems with chronic addiction issues, depression, PTSD, and other trauma, induced mental and behavioral health issues plaguing our peoples, we need to investigate out-of-the-box treatment and solutions, just like we use ceremonies in some tribes using their own forms of hallucinogens to aid in healing in the past, such as peyote amongst Arizona people. Can you imagine what it would be like if someone doesn't need to take hardcore medication that has multiple side effects, which can include death, or paying the extreme cost that some of the medications have, and then leading to adverse side effects, or being addicted to the medication themselves? That just seems to benefit the corporate pharmaceutical companies to have, or to just have another option that's other than what is used now. As I read in research, one main study on the treatment and research of psychedelic program, that are known as TRIP, T-R-I-P, has let patients do a federally regulated clinical trial open the door in a softly lit room and in comfortable sofa and with alternative therapists, testes. So what do we need to make the change in treatment and what we call medicine for treatment and mental health? We need to be able to investigate the alternative side of healing someone else and ourselves. Having an open mind and knowing that there can be many solutions to healing, finding a cure or making life better than what is just considered the standard norm. We can exercise our rights by voting for not to be considered a criminal and seeking treatment that is not mainstream or not issued by big pharmaceutical companies. And in closing, what is right or wrong is in how we use medications or therapy So let's make an informed decision and not just place judgment on others. And here's my picture of Magic. Okay. Thank you.
Thank